we'll crack on. So, Leanne, do you want to start as you're the first on the agenda? Welcome, everybody, by the way. I told you my brain's like lime jelly just at the moment. Leanne, please help me.
That's okay. I've got a voice this week. I didn't have a voice last week, so it's a good job I'm doing it this week. So I am able to share my screen, am I? Yeah. So I'm going to share my screen. So for those of you that don't know me, my name is Leanne. I'm the Community Engagement Officer at Pendle Council, and I think everybody on here pretty much I have a contact with in some context. And I am sorry to beat the drum, but if you haven't heard me speak about Crisis and Resilience Fund by now, that's what I'm going to be sharing about today. So I'm just going to share my screen and get the presentation up. So for those of you that have been around Pendle or Lancashire, let's say, for a while, will have heard hopefully of the Household Support Fund. So the Crisis and Resilience Fund, in effect, is now what was the Household Support Fund. Can I just check that people can see the PowerPoint?
We
Yeah,
can see
okay.
it, Leanne. Thank you.
That's fine. Okay. So this is just a brief overview of what the Crisis and Resilience Fund is, what food support is available during the school holidays, and also what support we are delivering for accessing online services. So it's a bit of a whistle-stop tour. So the Crisis and Resilience Fund, as I said, has replaced the Household Support Fund. So it's a 3-year fund, which gives our community organisations a little bit more stability and security. So the objective is to provide both a safety net for those on low incomes who encounter financial shock and to invest in building local financial resilience. So the outcomes of the fund is provision of effective crisis support. So we are obviously recognise that there's still a need for crisis support. There's always going to be families and households in crisis, but also to improve individuals' financial resilience and then strengthen local support systems within that fund. So there's 4 different strands. There's crisis payments, resilience services, housing payments, and community coordination. So for today, we're just going to focus on the crisis payment and resilience services. If you have any questions on the others, I'm happy to answer them. So the crisis payment at the moment is I've commissioned to administer by Citizens Advice East Lancashire. So they are the ones that are providing the financial support for those that are in crisis. The objective of this fund is to respond to households that are in a financial shock. So maybe somebody's lost their job. It's low income households, and maybe somebody's being made redundant. There's an unexpected health condition. There's a death in the family. A washing machine's completely broken, and they've not got anything put away for a rainy day. But the idea is it's a one-off shock payment. It's not designed for people that are continuously relying on those payments like shopping vouchers, which is what effectively the household support fund became to be in the end, that people almost became a little bit reliant on it. So there is quite a tight criteria, so that it does ask for what the shock is and evidence of bank details and like universal credit benefits. It also includes heating oil support. So this didn't used to be included in the household support fund. It was under a different funding strand, under the housing strand. But this is for those that maybe not be on the grid and that are still connected to the old-fashioned heating oil. And they've included this in the CRF because of what's happening with the war in Iran and how the cost of oil has gone up. So we can people can apply into the crisis fund for the oil support. So it's in a drop down box, and that's what you would click. It's public access through that link at the bottom, and it can be used for food, water, housing costs, hygiene products, essential household items, transport costs. And the idea is that it's a cash first approach. So it gives that household the autonomy to use that payment on exactly what is needed, or if it's needed to be split on maybe some food shopping, some petrol, some energy. So it gives them the autonomy to use it in the way that's needed for that household. The second part is our resilience services. So a lot of the organisations in Pendle that are listed on the page, you probably already are aware of, that are delivering services in the community. So Church on the Street, New Ground Together, Open Door, St John and St Philip's, Pavilion Community Hub, which is at Victoria Park in Nelson, St Bartholomew's Community Grocery, and Pendle Food for All. These are our current 8 CRF providers, and the idea is that they are resilience hubs. So what's going to happen is these are hubs, and out of these hubs are going to be operating resilience services, and the idea is to support those hubs to become help families to maximise their income and maximise their budget. So whether it be energy advice, cooking on a budget, accessing community groceries, doing benefit checks, employment support, enabling access to affordable warmth, grants, things like that. So outreach services will be delivered from a hub, so it's basically so that there's a no wrong door approach is what they say to this fund. When you when you go through that one door, you can access a range of different services. We also have it included in the resilience fund is a welfare package, and this includes citizen advice, who are going to manage our budget management, benefit advice, and basic form filling. We have Christians Against Poverty, who do budget management, benefit advice in the community, and for Christians Against Poverty as well, they do home visits. So they do offer a little bit more of a gentler approach for those people that may be housebound or might need a little bit of a befriending service. We have now commissioned ICANN as well, which is something that has been a massive gap for Pendle. So ICANN has specialised services in supporting residents to complete forms for benefits such as personal independence payment, attendance allowance, disabled living allowance. They will also do mandatory reconsiderations, appeals processes, tribunals, and attend court. And within this package as well, we also are carrying the affordable warmth. So that is a fund that's held in-house at Pendleborough Council, and we commission services to deliver the affordable warmth and energy support. So further details on the whole CRF programme can be found on that link. So this presentation has been sent already to CVS, so everybody will get a copy of this, so you can go on the link. The food support. So for those of you that don't know, when they brought in the Crisis and Resilience Fund, families who children received free school meals during school term time would previously have been given a code so that they could take that code to the supermarket during school holidays, and that's no longer a thing. So what we have done is created a little bit of a booklet that's been handed out directly through schools and through HAF providers that's going directly to those families that we know that we're going to struggle during the school holidays. And we're working with our CRF providers and other community organisations to just highlight what food support is out there in the community. So not just community centres, community cafes and food banks, but apps and also family hubs are going to continue the warm and welcome throughout the whole summer. So families can still go and access a warm space and get tea and toast for breakfast on the morning. So at least they're setting up the day right, if nothing else. And obviously as well during the summer we have our HAF provision. And finally, we have our support for accessing online services. So it's a massive recognition that there's a huge digital gap in the community. We have a lot of people that don't want to be online. We have a lot of people that can't get online, that don't have access to internet, don't have access to a device, don't know how to navigate the even the NHS app or getting a doctor's appointment. So we are delivering some sessions in the community where we are holding them in community provisions for the whole day, no appointment needed, complete drop-ins for people that just want support. And we actually are going to be doing some little pop-ups as well. So this weekend on Saturday we opened the town hall for community support because it was a Pendle Festival of Culture, and for Nelson, it was buzzing with families that were having lots of fun, but the town hall was also full of people that needed support with council tax, energy debt, and just not knowing how to navigate all of these different things on the simple devices that they have. So it is really essential support that we're delivering in the community, and with as part of the resilience offer, this digital support will be continued throughout Lancashire, running from the libraries as long as the Crisis and Resilience Fund continues. So for a little bit more support about what our online community support includes, there's a link to our community support hub, which advises people about where they can get support for mental health, where they can get support for children, young people services, affordable warmth, a digital exclusion, housing, homelessness. That's our community support hub page. It's really family friendly. And if I was to click on the link and show you, if it will take me, it's just loading. So if people can see, it is quite family friendly. It's very self-explanatory. If you go into one of those, underneath one of those sections, you'll find everything that you need to know. I'm gonna try go back onto the PowerPoint now. And that's it. Any questions, anybody?
Thank you, Leanne. I've got a couple of questions.
Yes.
Anybody else, just stick your hand up or wave at me. And so you talked about digital help for people, and you mentioned those that don't want to go online. What kind of help is there for those that really don't want an online presence?
Well, that's you mean for accessing, if they're wanting to access some funding, is that what you mean?
No, what I mean is if they're wanting to access absolutely anything, to be honest, because everything is online these days.
Yeah.
So is there anything that can be done to help people that really don't want to be online?
I think every service is different. So, GP services, NHS services, I'm not sure about those. I know that we at the council, everybody we all will always have one member of staff that's in the council office. If they do not want to access online services, however, they need to pay council tax, so they will always have an online presence on a, if they are a UK British citizen and they live in Pendle, they will have an online presence and a footprint. If they choose not to have a footprint through their own access, then that's completely up to them. And there will be people that don't want to have that footprint because of them being unsafe. So there'll be specialised services out there for those people if it is that they're unsafe due to being at risk of domestic abuse or stalking and harassment, which is obviously being highlighted quite heavily in the news. I know this week there's been a case that's been in the news, quite a high profile case. So for those cases, there'll be those specialised services that they will be directed to in order to make sure that they can be supported without having an online presence. And I know that there are services out there that are able to do that.
Yeah. Thank you, Leanne. And also community coordination. What's that all about?
So that's me, basically. So I think what's happened is I've come into post and recognised that we have a lot of community organisations that are working and know of each other, but haven't been working in partnership with each other. And I sort of started the ball rolling with the Food Network meeting that met quarterly in Pendle last year, a year ago.
Yeah.
And that was before the Crisis and Resilience Fund came in. So we started to work as a food network together a year ago, and as that's built over the last year, it's kind of evolved into I mean, we couldn't fit everybody in the room at our last meeting because it became so big. So what that's going to look like is going forwards is we are going to change that food network meeting into a resilience network, and it's going to be a Pendle resilience network. So it's going to involve health professionals, food food provisions, faith sector, statutory services, police. If the police want to come, we'll always have a guest speaker, and it's about making sure that all of our services that are in the community, whether they're funded, voluntary or statutory services, we're working together to provide a more resilient community. And it's about somebody coordinating that role. And I think I've done that, and we're in a really good position. I've started the ball rolling, so we're in a really good position in Pendle for that to continue to grow. And I think that's in essence that's what it is. It's just somebody being in post or two people being in post to coordinate that role. And as we move into local government reorganisation and we become larger unitaries, it will be about that coordination will become more. There'll just be more of us doing that, working in partnership together. But obviously we don't know what that looks like just yet.
Yeah, I'm just a bit concerned that it's duplicating People of Pendle, that's all. If it's not, if it's just purely about the resilience hubs and helping people to become more resilient, that's fine.
It's definitely not duplicating People of Pendle. We do a lot more targeted. We focus a lot more on targeted what people's strengths and barriers are. There's a lot more like what are the trends that you're seeing coming through? Is there something that we need to take on as a council, which is why we rolled out the drop-in sessions, because we found that there was a high rate of council tax debt. So rather than wait until it became a duty that the libraries offer digital support, we decided that we were going to take some digital support into the community before that became part of the fund. So then that's something that was highlighted because we have that network. And it, again, like I say, it started as a food network, and because our food partners are now are expected to be resilience hubs, it's just not organically they're going to be it's going to reflect that they're going to be resilience meetings where there's just wider partners involved, but we still do need the People of Pendle, because not everybody who's going to come to the People of Pendle will come to the networks, because they're in person as well, and they're only once every 3 months. So and like I say, they're quite targeted. So I don't know whether anybody else can agree with me on that or disagree, but I feel like it won't duplicate. I think it's very specific.
Good stuff. I'm just really conscious. I know we're all well busy, and about people going to multiple meetings, and it being a similar thing. You know where I'm coming from, Leanne.
Yeah,
so
yeah.
just will you keep us in the loop? Keep me in the loop. I know you're very good at that. You're very good at keeping us informed.
Absolutely, yeah. I know you've got a meeting coming up with Jill anyway, haven't you, this week? So I think she's got a couple of things to update you on.
Yeah, fab. Thank you, Leanne. Anybody else got any questions for Leanne? No, Lisa wants your email address. Lisa.
Okay.
Yeah, it literally was. Can I have your email address, sweetheart?
Of course you can, yeah. I'll pop it in the chat.
Can I just ask something? Rabina, who is our partnership manager for the Pendle area, I know that she has tried to put promote some online digital services to access provision and people who need help with council tax and everything else. So there is something going on. Does anybody know about it? I'm sorry, I'm not being funny.
Who's? I'm really sorry. Who is it that's asking?
Sorry, it's Julie.
Oh,
Sorry,
is it Julia?
It's Julia. Yes.
Also, that's the digital sessions that Rabina's doing with me.
Right.
Yeah, so
Okie doke. Yes,
there's
that's fine.
we're going into the community. I didn't want to spend too much time because I was very mindful of time, but the
Right, that's fine.
DWP, Citizens
Yeah.
Advice, Christians
Yeah.
Against Poverty, Advocacy Focus,
Yeah.
Health,
Okay.
we're just all going out and just taking over the community and saying, please come in and drop in and just access all
Right,
of
brilliant.
these different types of support. Really, we're trying to get as many people as much support in a day as we can, really.
Super duper. Thank you very much.
No worries.
Thank you, Leanne. Has anybody else got any questions or anything for Leanne? No, nobody's waving at me. No, fab. Thank you, Leanne.
One last thing to mention about the crisis payment.
Yeah.
A household can only access that payment once every 6 months. So, and there is a maximum amount that they have a cap. So if they apply for a small amount in the first 6 months and then they apply for another amount in the second 6 months, that it once they reach the cap, whatever that is for that household, depending on how many children there is, they won't be allocated it again. So it's not going to be like the household support fund was, where they could continue to apply for it. It will be capped.
Does this run for 3 years, Leanne? Have I got that right?
It does run for 3 years, yes. So it's a 2 at the moment. We've been the CRF providers have been given 2 years funding, and then we'll get the third year at the back. So the idea is that obviously year one we're going to really I spend a lot of time with those services that are delivering crisis support, like the food banks, like the community groceries, that are doing that really on the ground, grassroots, and helping them build into the resilience hubs. So it's going to take a year really to help them, to build them up and to grow them. And the second year will be in a bit of a full swing. Then we'll be able to see what that looks like, and we are looking to expand into the Briarfield area because we're very aware that that's a gap. And also we're looking at we recognise with our CRF providers that we do not have a lot of recognition, anybody that can be a representative of the South Asian community. So we at the moment we're doing quite a bit of research, myself and Jill, into South Asian groups or community groups and organisations that are really connected with that community in Nelson and Briarfield. So if anybody knows of any specific groups, other than we've got the Dean Centre, we know that Harrington's, we've got a couple of others, we've got a couple of things that Sanya's running, but anything specific that are really working with the South Asian community around the Briarfield area, just drop me an email. It'd be really great just to go out and visit them, have a chat with them, find out what the needs are, because we recognise that it's a gap, and it's something that we really want to make sure that we're providing that support for that service in a really culturally competent way, because not all people they'll be drawn to people from the same ethnic minority as themselves. So we're very aware of that. So we want to make sure that we're fully representative of what the Pendle picture looks like.
Leanne, email our group support and just ask them for groups that are representative of South Asian communities that have been funded through us. Sanya, I'm surprised you didn't put your hand up before this. Sanya.
Because I've already emailed Leanne back when she was asking me, but I just wanted to mention about the toolkit. I don't know who's got it now at the moment, but that was the work that we did last year. And there's actually, if you look at Bradfield, it will give you all the groups. So there's quite a lot, and especially in Northland, I've got quite a lot of groups going on there.
Yeah, that's what I've got. So, does anybody...
Yeah, but it's something in the something that I wanted to mention as well, that I'm hoping to do something as well in Bradfield. I think I emailed you regarding that, Leanne. So watch this space, as they say.
Thank you, Sanya.
Thank you.
Tracy,
Leanne,
what's that email? What's that email did you say it was?
group support. So it's group support at BPRCVS.co.uk.
Perfect, thank you.
Thank you very much. Also, Leanne, can I just check with you, and then I promise folks we'll move on. That the resilience hub will be linked. The resilience hubs will be linked in with the social connectors and social prescribing link workers. If they're not already.
Yeah, I think they all are already, but it's part of the me and Jill have been round to see them all, and they all are already connected with them anyway. But yes, they will.
It'd be good. It'd be good to know, particularly for like Pendle East. Do the ones in Colne and Barnoldswick know that there are social connectors available through CVS and not just link workers through the PCN? I know it's confusing for them, but there's more support there, is what I'm trying to say. I think
maybe it's a discussion that we can have out of this meeting. Maybe I think.
Okay, all right, Leanne. Okay, thank you very much, Leanne. Very comprehensive. So we'll move on. We'll just go into information sharing, I think. And I'll just go around my screen. You don't have to update, you don't have to say anything, you can just shake your head at me or go, I've got nothing. Nobody's going to think any worse of you. It's entirely up to you. So I'm going to start with Caroline, because I'm sorry, Caroline, but you're first on my screen. So Caroline.
I haven't got much to update at the moment, I'm afraid.
That's all right. Community. What is it? Cancer Awareness Champions. Do you want to talk a bit about that?
Yeah, me and my colleague Rebecca have revamped our approach to Cancer Awareness Champions. It's working in collaboration with Spring North and Lancashire something alliance, sorry, integrated care possibly, and we are looking to recruit cancer awareness champions. Now that means being aware of the early warning signs of cancer and spreading that information around your community or workplace. But it's very low level, and it's more of a signposting scheme than anything else. It's just to be aware of the symptoms of cancer and when you think like a colleague or someone in your community might need to visit their doctor, and being aware of when screening, like the breast cancer screening comes available in the local area, and making people aware of that. It's very low level, like I say. You don't have to attend any events or anything. All we ask is that you complete an online form each week to tell us about your activities in the area. We're thinking of putting some more training on in the coming months, so watch this space. If you're interested, please either email me, caroline.littleworth@bprcvs.co.uk, and yeah, we'll be in touch about further training and stuff.
I know Rebecca's put out there a training needs analysis, which is poshly called training needs analysis, but it's just a form that's been sent out. It's going on to our info share if it's not there already, about needs in the community. So any volunteer training needs. So if you've got volunteers or you are a volunteer and you think, oh yeah, I could do with some training on this, that, the other, please do fill in that form. The Cancer Awareness Champions, you're not expected to be an expert. I do it all the time, completely without training, because Lisa will tell you I just don't have time to do the training. But I do talk about it all the time, talk about my experience. 3 years ago, I was diagnosed with breast cancer. I'm still here to tell the tale because I caught it early. And if you catch it early, yeah, it's scary, and yeah, it is really anxiety making, and it does leave you with some health paranoia and all sorts of stuff. However, I'm alive, so and that's through going and getting myself checked out. So please do get yourself checked out. I know there's a campaign at the moment around cervical screening. Please do get yourself checked. I know it's not the most dignified thing in the world, and you know, sometimes it does hurt, but it could save your life. So please do get out there. So I've done my bit, Caroline. Please fill me form in for me. We also have Coffee, Cake and Collaboration, which was it in Pendle? It was in Pendle last week, weren't it? Yeah. Yeah. And if you've not heard of Coffee, Cake and Collaboration, this is a session that we hold once a month for volunteers, volunteer involving groups, anybody really that wants to come along and eat some cake and drink a brew and talk to us, really. So this is Karen comes, don't you, Karen? You're there, you're a regular visitor for us.
I'm sorry, I was on leave last week. I'm really sorry I couldn't come.
We missed you.
We're going to make sure it's not on a Wednesday next time, Karen, so you can come along.
Okay, yeah, I had to
you
work the
keep missing it, don't you?
Wednesday. I did take that as leave and then I had to go in because I had to meet up with Leanne.
It's either one or other of us demanding your time, isn't it, Karen?
Oh, yeah, blame me. It's okay. I don't mind.
Fabulous. So if you want to get involved in Coffee, Cake and Collaboration, we have homemade cakes. So Caroline's sister quite often makes some lovely cakes. And also we had one of our communications chaps, Tom, his girlfriend made some, what did she make? Banana bread and lemon drizzle or something like that. Yeah.
Yeah.
And really Lisa's testifying to the fact that all of them were absolutely delicious.
Lemon drizzle to die for.
Can't believe you let Lisa near lemon
Lovely.
drizzle.
Honest to
we
God.
had 2 lemon drizzle cakes, so
Absolutely
you had to get 2 slices, one of each.
Yeah.
And
Of course.
Need to come
It
to the
would have
next
been
one
rude
then.
not to.
Fabulous. Thank you, Caroline. Lisa, you're next on the screen.
Okay. I have a couple of things coming up in July that LACVS are doing. Unfortunately, they're both on in Burnley. And it just happened that way. It's not because we'll do them in Burnley. It's just happened to have happened that way. The first one is on Friday, the 17th of July, 9:30 till 11:30. We're doing a bit of work with the DWP. Now, this is really complex, which is why we're doing an event about it, because I even get it wrong. So they have a procurement system where people can bid on pieces of work. The easiest way to describe it is with ESOL. So at the moment, they have people who have an ESOL provision of their clients, their customers, and they've got people parachuting in from Manchester who've bidded on the work and are delivering it, rather than somebody in Burnley, Pendle or Rosendale doing it. I was aghast, as you could imagine, and went, this is not good enough. How can we make sure that people, including CVS, are actually knowing about this, knowing how to do it and signing up to it? Anyway,
Lisa, can I
love.
interrupt? So you said DWP?
Yes.
The
Your procurement system. So I've been talking to Nicola Avery around it.
right, okay.
And so Nicola has asked for us to put something on for community groups or anyone who might want to bid on a piece of work. Now, it could be anything, absolutely anything at all.
So Friday the 17th, 9:30
Friday the 17th, 9:30 till 11:30. I'll send the flyer through to Trace or to Tom. And literally what we're going to do is we're going to talk about how the whole system works, but then we're going to do a really good fun workshop, because I believe that's going to be quite a dry 3/4 of an hour, around working out what our specialisms are, because we all have so many and maybe we don't realise it. So it's going to be at Newtown Mill. So Uland's new building in down in Burnley. If you're interested, you just email me. I'll get you booked on. I'll send you the details through. We have room for about 20 odd people, so we've got loads and loads and loads of room. So yeah, if you think it could be you, and if you think actually I wouldn't mind being paid for putting that training on, please come along. They're going to have the guy there who signs you up. He's coming over from deepest, darkest Skelmersdale. And they can talk you through it because it is complex. But once you get your head around it, you go, oh, right, yeah. Like bidding on most things, you know, when we do most funding. So we've got that coming up. The other really exciting thing we've got coming up is there is an organisation called Tame the Tiger Academy. And the guy, Peter, who runs this, he does sessions for organisations usually where he will train you on how to use Outlook so that you are not you're not spending half an hour a day on Outlook going, ugh. You can set it up so it automatically does things for you and you can learn how to use it more proficiently. And I'm actually going to be going on it because I'm the world's worst on Outlook. And I do spend a lot of time going, where's that email? What have I done with this? I don't know. Anyway, these are usually paid for sessions. We have got him to give us 12 places, so we've 8 places left. They are aimed at larger groups and organisations, statutory services. It's aimed for sort of professionals rather than small groups, to be fair. But with 8 spaces left. We're going to have it at Downtown in Burnley. They've let us have one of their rooms. And that is on the 22nd of July, 9 till 12 noon. Again, I'll send the flyer through, but if you're interested, again, let me know and I'll book you on. It's a real opportunity because we don't get it very often. That we actually get free stuff to offer out. So again, that's really useful. The last thing is the Lancashire Volunteer Managers Forum. The next one is on Thursday, the 16th of July. If you'd like to come along, I will send the QR codes through to Tom again, and you just book on and come along. And that is me, unless anyone has any questions.
Sorry, Lisa, can I? What was the last bit? The Lancashire Volunteer
Managers Forum.
Right, okie doke. And that is when?
So the next one is the 16th of July. If you're not already booked to come on each one, you need to fill out one form. You only fill it out once, then you get invited to each meeting, but you do need to book on. So yeah, that will go out when I send everything through as well.
Will that go out on the updates, Tracy?
Yes, it will.
Right. Okie doke. Sorry.
It's okay.
It's all right. Just to let everybody know, we don't send individual emails out with all this publicity because it drives people up the wall. So, because we all get a million emails a day anyway, but all this information will be on the People of Pendle webpage on our website. So please do have a look on there. Please do also sign up for our InfoShare newsletter because everything will be in there as well. And that goes out every week. So thank you, Lisa.
Yeah. And
thank you very much.
I'll pop my email in the chat. So if anybody does want to email me about anything separately, you can.
Fab. Thank you, Lisa. Everything that you've just said, I'm on leave for. So I can't come to any of them. So
obviously I did that on purpose.
Of course you did. Of course you did. I would say unfortunately, but it's fortunate for me that I am off and counting 2 weeks today and I'm on leave. I'm not going anywhere. I'm just not working. Hooray. Sorry. So Karen, you're next on my screen. Have you got anything that you'd like to update us on?
We're very, very busy. We're seeing a massive increase in referrals. Like we're saying, I've been on leave. We only had 2.5 days last week. Come back to about 4, 5 schools asking more about the service that we offer. Obviously, you know, over the summer, maybe they're looking at some of the families that need supporting. But what they have said is 3 of the schools have said that people are actually going and asking, can they be referred in? because they've heard from family and friends, and they've actually saying that these people don't. And I said, well, they need to have unmet needs. They need to be, identified as vulnerable. And that's down to you guys really in the school to prioritise who. So just keeping an eye on that really, just to make sure that we are still being accessed fairly, if you know what I mean.
Yeah.
Okay. We're doing really well organising an event for the summer. Just need to book a date with Dawn to try and see if the zone's available on a Saturday morning for us guys and partners as well. So we'll be putting all that out probably over the next few weeks when we've confirmed the date, and of course it'll be around food, and we're looking at doing like a food drive and games around food to encourage healthy eating with children. And that's us really at the moment.
Fab. Thank you, Karen. Thank you very much.
That sounds good. Karen,
Julia.
I'm on leave this Wednesday, Thursday, but I will talk to you.
Okay.
All right,
Sorry about
sweetheart,
it.
no problem.
Fab. I've got another request for you as well, Dawn, but I'll come to that when I come to you. Julia, you're next.
Hello. Not a great deal really. I was just going to promote the health event that we're having in Cone. I'm not sure if everybody knows about it. We're working with Anissa from the council. There's a massive health event in October. We're going to be looking at well-being, how we can support people that are out of work. We're trying to do it as interactive as well. We may have about 40 organisations going. It's going to be at the Colne Leisure Centre. So we've not sent invites out, but if anybody would like to attend, I'll put my email in the chat and you can just send me details. Should be absolutely fabulous. With 40 odd healthcare providers and charities and stuff like that.
Are we on your list, Julia? Do you know?
Oh, of
It don't matter.
course.
Of course we
No,
are.
I've
Of
been
course we
doing,
are.
so we've got Anissa from the council doing a list. We've got myself with Over Contacts doing the list. We've got everybody involved that we can think of. So it should be a really, really big event. Sure, it will get a lot of publicity. Apparently it can hold a heck of a lot of providers and customers. But planning stages at the moment, but that is for October. So yes, Tracy, you're already on my list. I've already written you down.
Thank you very much. Thank you.
Yeah.
Thanks, Julia. Thank you very much. Sania, you're next on my screen.
Hi, just to let everyone know that this Saturday we've got the Community Fun Day, which is at Brighfield Community Centre. So we've got a lot of community organisations coming, including Family Hubs, Pendle West, Community CVS, and quite a few other organisations. And then there's going to be some stalls and plenty of activities for children. So that's this Saturday, and it's from 12 till 6, and it's in Brighfield Community Centre. Thank you.
Thank you, Sania. Lovely. Thank you very much. Sarah.
Hi everyone. Yeah, no updates really from Pendle West INT. Catherine's been on annual leave for just over 2 weeks. She's due back tomorrow, so she's got a fair few referrals to come back to. Other than that, everything else is okay. So yeah, no updates.
Fab. Thank you, Sarah. Thank you very much.
Thanks.
Paula, you're next.
Hello. No, not that I can think of for Pendle area. For those who I haven't met before, I'm new to New Era. I'm on week 6, so I'm joining in as many meetings as I can. I'm also
you used to be
working.
one of our volunteers, didn't you?
I did. I'm also working on the Crisis and Resilience Fund, so we're doing similar activities throughout Burnley. Today for me is more about joining in this meeting just to see what's going on further afield than Burnley, because although for us the CRF is just Burnley, what we offer is wider than that with some of our other provisions. So that's why I've joined in today, but I don't have an update.
Lovely
Thank
to
you.
see you, Paula. Thank you very much.
You.
Yeah, we really miss Paula. She was the best volunteer. But the best volunteers always get a job, don't you?
Absolutely. Thank you.
Fab. Thank you, Paula. Dawn.
Oh, where do I start?
We've got a few things coming up. So we have, if anybody wants to come to our Pendle Family Hub Network meeting, that is next Tuesday, the 7th. It's 1:30 till 2:30. If you drop me a message, that one's on Teams, so you're welcome to come to that. Just drop me a message and I'll send you an invite. But the following week, I'm just going to put it in the chat, we have a multi-agency marketplace event, which is going to be here at Nelson Family Hub. So we've got, I think, 20 odd organisations so far signed up for it. We're hoping for a little bit of a boost next week, but if you want a stall, let me know and I'll book you in. If you just want to come along, you can just come along anytime between 10 and 2. We'll have refreshments and lots of people to speak to. I know last time we did it, it was probably the loudest room I've been in outside of a rock concert, because there were so many people trying to talk at once. It was brilliant, but it was just crazy busy. It was great. So that's coming up. We've got lots of exciting new things coming up with Best Start in Life, which I will be updating you all about when I get more information. But we're going to be having family hubs on the move. So we're going to be with some new team just recruited at the moment. So they officially start their new hours on the 1st of July, but probably later on in the summer by the time they get out. But they'll be coming out to community organisations. We've got the info bus. They'll be coming out to maybe existing community play groups and then anything else. So if you're working with an organisation that would want us to, come out and give some information and maybe put some groups on, just let us know. But yeah, we're working out a pathway for that at the moment. And then we have, I'll send these to you, Tracy, and then you can send them all out, because they've sent them to me on 6 different PDFs. But our targeted youth support have been organising activities. A lot of them are half, but there's like 6 separate things. So some you can just come to, most of them need booking on the half. But if you've got anybody that you're working with that qualifies for free school meals, I'll send all this out, and it does say which ones are half that need booking on, and it's got all the ages and everything. But they've actually got a really good offer this year. So they've got trips to Tower Wood. They have, we've got some events in parks with sports and inflatables, things like that. There's a Blackpool Pleasure Beach trip. There's swimming. There's quite a lot of things going on across the summer. So I will send those out so you can have a good look. I noticed that Helen's in the group, so I don't want to steal Helen's thunder, but we've got one of Evolve Path will be coming into our centres as well. I've started coming into our centres, but assuming Helen might want to talk about that.
Okay, fab. Dawn, what I wanted to ask you was, is the hub available on 27th of July for People of Pendle face to face?
27th of July, let's have a look. Changed Outlook, I don't like it. Unfortunately, it's not. We've got Bernardo's. They do their break time activity, so they've got the sports all booked on Mondays right throughout the summer, I'm afraid.
Okay, no worries.
We would otherwise I'd have jumped at Avenue in, but yeah, we've got that on, unfortunately.
That's okay. I thought I'd ask you first.
Yeah, so they'll be finished by sort of the end of the summer. So if you want like one further later on in the year, we might be able to accommodate. But just that next one, it is already booked, I'm afraid. I think they booked it last year.
We have another in November, so I'll shout to you near the time. Thank you.
Yeah, that's fine.
Thanks, Dawn. Helen, last but not least.
Sorry, I can't turn my camera on. I've just got a new works laptop and I'm still trying to get everything sorted. Hence the reason I was a bit late getting on, because it didn't even have Zoom on.
Don't worry. Leanne's had the same problem.
Yeah, so I'm Helen. I work for PAC on the PATH project, as Dawn just said. The PATH project is a peer support group for parents of children that are struggling with emotional well-being and mental health and neurodiverse needs. We've just literally had our first session in the Nelson Family Hub, but we are across the whole of East Lancashire. PAF is actually based across the whole of Lancashire and South Cumbria. We're funded by Spring North and the ICB. So just to deliver support. So I've also offer one-to-one sessions and things like that, but I don't really have anything new apart from the session that's at the Nelson Family Hub that is on the second Tuesday of every month. Am I right with that, Dawn? I think I am.
I've just shared the poster in the chat.
Oh, thank you very much. I can't
So
get
it
to all
is-
that. This is the new laptop, and we can't share stuff. We can't talk on Zoom on. We can't use Zoom on our actual board, but then we can't share stuff very easily. So thank you, Dawn.
That's right.
Thank you, Helen. Thank you, Dawn. So what we're after is we want a venue for the 27th of July for our face-to-face. I think our last face-to-face, please correct me if I'm wrong, was at the town hall, I think. So
wasn't it at number 1?
no.
Oh, Tracy,
Oh, it might have been.
all I
Yeah.
remembered was doing the okie kokie.
Oh, that would the yeah. That weren't that it was the health gathering, I think, with that.
That was
Yeah.
so funny because I've been training somebody up as a new disability advisor, and it was his first outing ever. And he came in late, and I said, "Come on, stand up." And he's 6'2". I said, "We're doing okie kokie," and he went, "But what?" I said, "You either do it or you don't. If you want this job, you do it." And it's like, sorry. Honestly, that was so funny, Tracy.
It's been talked about quite a lot. I mean, we did the hokey cokey at our AGM as well, and we had Lord Shuttleworth doing the hokey cokey, who's like 86, and he loved it. He said,
Yeah, but there were about 50 odd 60 of us, Tracy. That was so funny.
Yeah. Well, there were over 100 at the health gathering. And oh yeah, I love putting people because everybody knows it and everybody does it. I'm gonna have to think of a new song though. I'm gonna have to think of a new
I
one.
went back to work and they all went, "So what do you get from the health gathering, Julie?" I went, "Well, we had a really good time doing okie kokie." They went, "Bonkers, absolutely bonkers." I said, "Not my fault." I said it was Tracy that did it.
Exercise, it's getting you moving after your dinner. That's what it were. Do you know what? I was knackered after that as well.
You worked hard that day, Tracy.
So a venue, if anybody's got a venue, please do whiz me an email and let me know. It's the 27th of July we usually do it 2 o'clock till 3:30, so just an hour and a half. If not,
Tracy, we do have some space at the town hall, but it depends what room it just depends what room that you want. So I know that in the room where you did all of the questions.
Yeah.
I don't have access to that calendar,
okay.
but I do have access to the Wilson room, which is another conference room, which is free that day. I don't know if you want me to provisionally pencil that in.
Book it, Leanne, for us, will you? Please?
How many people do you think it would need to hold?
There's usually between 20 and 30.
Oh, the Wilson room would be fine then. We just might have to. It does that. It did our whole team Christmas quiz in there, so I'm sure it'll be fine.
It'll be fine. Thank you, Leanne. Thank you very much for that.
So 2 till 3:30, did you say?
2 till 3:30. That'd be brilliant.
Okay. Yeah. Okay.
Where will
then.
that be? Sorry.
At the Nelson Town Hall. Nelson Town
Room
Hall.
Town Hall.
Wilson room.
Fab. That's great. Thank you, Leanne. Thank you for that.
Was that the 28th?
27th.
7th, right. I'll look at the 28th and CCC, maybe.
Yeah, the day after. Yeah, fab. Thank you very much. I'll just give a really quick update. I have prepared nothing. I'm very unprepared today because I've been working on, we're going in for an accreditation for local infrastructure, a quality accreditation. So I've been working on that. And as you can imagine, It's a bit like an Ofsted report. You've got to have a million pieces of evidence. And we've already got our volunteering one. Thank you to Lisa and Caroline. We've already got our volunteering accreditation, but we're after the local infrastructure one, and it's been down to me this time. So, so I've been working on that. So I'm very apologetic. I have nothing prepared. However, the usual stuff still stands. What I said about publicity, please do send any and all publicity to our Tom. The email address is in the chat. If you are feeling generous and you want to spend £1 a week joining our lottery, please do. It's the Helping Hands lottery. That's also on our website. And it's just £1 a week, and you get to raise money for either your organisation, Care, and I would suggest that Pendle Food for All, if they haven't already, sign up for it, because you can raise money on there.
I did bring it to our trustees' attention, but they said no. So
really, right, okay.
Sorry, I know.
They'll have their own reasons.
I'll bring it back again.
Yeah, because it's well worth it. It is really well worth it. You know, you sell your own raffle tickets and you get most of that money from the raffle tickets. So plus you get some from, you know, the others, and the great prizes. I think there's a holiday at the moment, a weekend away at the moment. So really good prizes. So yes, please do. Yeah. Please do sign up for that. Please do sign your groups up for that. I know some people object on the, you know, on the it's gambling, so you know that kind of thing. So I completely understand, but it's a shame because small groups will lose out. I can't think of anything else. My brain is scrambled, so I can't think of anything else. But please do, if we can help with anything, please do give me a shout. And if anybody has got anything that they want to publicise, please send it to us. And we're here. So don't forget about us. We're CVS and we're here. So thank you all very much. I think we are bang on time according to my computer clock. It's probably 25 minutes past 5 at some other clocks, but according to my computer clock it is 3 o'clock. So thank you very much, everybody. Thank you for being so engaged.
Thanks, everyone.
And so entertaining, and thank you, Leanne, for informing us about the Resilience Fund. And take care all. Keep cool. Take care all. Bye.
Thank you.
See you next time.